Hi, everyone. You're listening to Let's Psyconnect. This is LT.
And this is Ronnie.
So today we're doing something different. Usually you only hear us, right, when we're listening to an episode, but we also make this episode available in our Instagram account. So you can watch it on our Instagram, Let's Psyconnect, all one word, lowercase. It's also going to be available on our Facebook account and Twitter. Like, we're going to have the links over there so that you can navigate it to Instagram via those pages as well. So today we are going to talk about bariatric surgery and mental health. We are both very interested in this topic, more so Ronnie, but we actually joined our heads together. We put our heads together in the beginning of grad school to think more about bariatric surgery and the components of mental health. So what one goes through, what can mental health professionals do, or what they usually do to assist patients that might undergo bariatric surgery. So we learned a lot throughout the process, and we thought about digging back, through that research that we did back then, and try to update it and share the knowledge with you guys. We're not experts on the topic whatsoever. We're solely reliant on the findings from research and materials that we went over to put together for the presentation or this episode.
Sure. Yeah, LT. As you mentioned, it's going to be something a little bit different. So this is actually a pretty streamlined topic, right? So not every day do you have a conversation about bariatric surgery, nor bariatric surgery and compensatory behaviors post-operation. But we're going to get into all of that. So bear with us, and we'll talk a little bit of background about obesity, what that means, right? We'll give just a general definition. We're going to talk about some factors associated with obesity, and you'll hear us talk about comorbidities again, which is one of our favorite words, but that is heavy in this population, and it gives some credence as to why the mental health aspect is there, right? And then we'll talk a little bit about some of the causality and effectiveness of bariatric surgery, right? Because we hear this term quite a bit. It's becoming to grow more popular, and it's a solution for many individuals. And we're gonna talk a little bit about why it is so effective and what we can do to implement that some more.
Yeah, so there's so much to discuss. Again, we're going to try to summarize as much as possible and share the content with you. And we will be coming back for another episode on this topic, because we want to talk about compensatory behavior. So something that to look for and be concerned or be mindful of when it comes to bariatric surgery. So let's go ahead. Well, let's start talking about obesity. What is obesity?
Right. So I think that this is a question that is very general, but super pertinent, right? We hear the term obese floated around quite a bit. Our country's becoming more and more obese, right? Obesity is a concern. But what exactly does that mean? And the medical diagnosis of obesity really comes about by the BMI, right? The body mass index. And again, we're not as experts, but I do want to touch on the fact that there are some pushback with the BMI, but as that diagnosis it comes into play, the medical physician does take into account some of those factors and variables that could affect BMI, right? So once the BMI is at a certain level, an individual is deemed overweight, and then the next step would be obese. And there's actually 3 classes, right? So the first class is between 30 to 35. Class 2 is between 35 to 40, and then class 3 is a BMI of 40 or higher. And this is actually considered more like a severe obese presentation, right? So what are some of the causes of obesity? And honestly, LT, we could sit here and have a whole podcast just on the causes and different things that could come into play. But I just want to break it down into 2 categories, right? So you have more of a genetic predisposition to obesity and a behavioral disposition. So it's kind of a combination of those 2. And some individuals more so a behavioral component than the genetic, and in others the contrary. But we can also think about causes of obesity and things like a medical diagnosis, right? So just thinking about a diagnosis of diabetes, right? Or a diagnosis of a immune system disorder, right? So something that is kind of out of your control and it's really affecting that metabolic rate in a way.
Yeah. Yeah. So with that, there's so much, right? I mean, like, one, you're saying that it's much more of a medical diagnosis, right? So usually people who go to a physician, they will be receiving that label per se, right?
Sure.
Yeah, as mental health professional can also consider what's under the DSM, or we've been trained to, again, talk about one's appearance, right? Including their body weight in relation to the body weight in relation to their height, and what would be considered healthy and what not. Because with the definition of the BMI per se, you know, it's also important to note that some people will meet or pass the threshold of a certain BMI class, but they're not necessarily considered unhealthy, right? We see a lot of people who are training, like physical training, and therefore their weight increases. But when you're comparing to another person with a similar BMI, there's going to be a difference in one metabolic rate and physical functioning and whatnot. So again, like, there's controversies associated with the use of BMI. Nevertheless, it helps medical professionals and it helps others understand what might be going on within somebody's system. And the other end of this coin, the other side of this coin, is thinking of, like, it's not a mental health diagnosis, but then again, it's associated with behavior, right? So eating behaviors and other, we're going to talk about comorbidities here. So other mental health diagnosis that might be influencing one's behavior of eating and maybe not engaging in physical activity and whatnot.
Yeah, definitely. And I love that you go ahead and add in that mental health component by saying that, you know, a lot of times there is a behavioral component, and that's something that mental health professionals do work with. And I know bariatric surgery is, again, kind of a general term. There's TV shows, movies about it, and I don't think it does the mental health aspect of it justice, right? It's not a big part in some of the media portrayals of bariatric surgery, but as we both know, LT, a mental health professional actually has to be there along with the process of this surgical evaluation, pre-op and post-op.
Yeah, it's what's ideal, right? We're going to talk about it, like whether or not the ideal world meets real world. We actually have a poster on that too. But, you know, like, just the word itself, obesity, and then one's appearance as obese are classified by any person. You know, when you see somebody, oh, this person is obese, it has a negative connotation to that, right? There's a lot of stigma, which again influences one's mental health. And there are misconceptions, right? There's a lot of myths associated with obesity. Oh, you're just obese because of, like, you don't work out, there's no physical activity, or you eat poorly. But there's also knowledge, you know, showing that that's not true. You know, there's people who engage in physical activity and they remain and they continue to be classified as obese. Recently, it came out on the news as this woman, she's considered obese and she's ultra marathonist, you know. So it's not the lack of physical exercise, right? And it's not laziness, right? There are a lot of other components that come together that play a role in being obese or not.
Sure, and it goes back to some of those causes, right? So things like stress, right? Lack of sleep. Those are all things that can actually impact our weight and become variables into obesity.
Yeah.
Right. But in general, with all of that said, you know, I think now the majority of research is starting to show that obesity, however the cause, is starting to become a global concern, right? And more specifically in the United States, you know, if you look at really any of the stats, it's trending upwards, right? So this is a conversation I think that is very important to have and to really understand, at least generally, what obesity means and some things that we can do as well.
Yeah. I mean, I know it's a big problem in Mexico. It's a big problem in Brazil as well. And it's just spread around the world. There's a lot of association with the availability of fast food and other high caloric food. But then, as we know, it's not just that. There's much more to that. And one of the concerns associated with obese is the possible medical or physical damage that it can do to your body, right? So thinking about the comorbidities with obesity and the physical or the medical conditions, you have heart failure, you have type 2 diabetes, right? You have other cardiovascular diseases too. You have hypertension. There's also something called chronic obstructive pulmonary disease, so COPD, or other pulmonary disease. Some other individuals report asthma. And of course, you know, I shouldn't be saying of course, but there's a high association between obesity and sleep apnea.
Sure. And a lot of these, if not all of them, can actually lead to death, right? So we know also that obesity is highly comorbid with just general death from multiple causes, right? So maybe not just the factor of obesity, of being overweight causes death, but these other comorbidities do increase the chances, unfortunately.
Yeah. Right. And not only that, we see the association between this medical conditions and the mental health conditions too, right? And all of those, well, almost all of the conditions that I mentioned, and again, this list is not extensive here. We just mentioned a few of the medical conditions associated with obesity, but most of them are associated with inflammatory markers, which again is associated with obesity and is associated with several medical conditions.
So the health psychology component always comes back around.
Yeah, and in women, you also see polycystic ovary syndrome to be associated with obesity. So it's something else. Maybe you don't think about it right off, like, oh, if you have PCOS, then obesity is like of concern to you, right? You don't usually associate it to you. And then urinary stress incontinence, so UTI infections too, and infertility can be associated with that, miscarriage. So there's a lot. Yeah,
definitely. And so LT, you did a great job touching on some of the medical conditions that could be associated. But now let's talk a little bit about the psychological comorbidities, right? And just so before we present any stats or any research, let's just think about the presentation of an individual who's been diagnosed with obesity. It may have some of these more severe medical complications, right? So let's just take for example, a obese individual with maybe COPD, right? Maybe there's some difficulty getting around, difficulty walking, doing things. This, of course, it makes it difficult physically, but psychologically, right? When the quality of life is decreasing, or health-related quality of life has been decreased, and which studies do show that obesity and health-related quality of life have an inverse interaction. So when that does decrease, some of these more, psychological symptoms tend to fester, right? Things like depression, things like anxiety, things like stress and worry, they start to bubble up as that quality of life decreases, right?
And it just, like something that I mentioned before, right? You know, there's a negative connotation associated with obesity, right? The way you present yourself, if people see your body, or you're not skinny, then, you know, you're like X and Y and Z. I don't need to say all the names that people are called, you know, but you have an idea, which is really sad, you know, and it affects one's, again, self-esteem and wanting or desire to go out, you know, and do things, and wanting to be in a relationship, you know, who's going to love me, right? So a lot of questioning and maybe feelings of worthlessness, you know, comes to it becomes prevalent as well. So, and you mentioned depression, you know, and so if you think about eating too, right? If I eat in front of people are going to be judging me all the time because I look this way, and now I'm eating I don't know what, and then people are still going to be thinking like, oh my gosh, this person has, again, all the labels in their mind. There's a lot of judgment, and again, if it's a cycle. It's a negative cycle here.
Right. It impacts just your social interactions, interpersonal interactions with people in general, and starts to make you doubt just a lot of your own behaviors, right? And your own thought processes. So there has been quite a bit of research in this area, and there does show, or the research does show, an increase in depressive symptoms, right? Generalized anxiety, social phobia, increase in stress with this population. So as a mental health professional, or as a striving mental health professional, this is something that you should keep in mind. If you're working in the medical setting, or even if you're working just one-on-one in a therapeutic setting, and you have an individual who does meet this medical diagnosis, these are all, I think, very, very important points to take record of, right? And just getting their symptomatology current and past, and kind of how they're feeling about their own presentation. Because that may not be something easy to speak about and talk about. Yeah.
And then if you think about it, like, all the myths associated with being obese that I mentioned, I know I mentioned one, but like the lack of physical activity, you know, but another myth is just like go on a diet and then you're going to lose weight, as if it was something that easy, right? And then, or if going on a diet, it means that you're going to have long-term outcomes. Then again, that's a myth, because it takes a lot of, it's very difficult to maintain the weight loss, and most people tend to gain some type of weight afterwards anyway. So again, it's not because of laziness or because they don't want it, right? There's no like lack of willpower here necessarily. A lot of times it is because of genetic composition or changes to your metabolic process here, like physiological changes that maintain that sort of state in your body too. Definitely. So that I think makes people wonder, like, what are my options, right? I have tried diet X, Y, and Z. I've gone for walks, I've done this and that, you know, or like physical activity is not for me, because obesity is also associated with pain. So if they're going to work out, I think they're going to be in pain. Even though research has shown that if you do work out, you're going to actually, you're likely to experience less pain. But don't do that just because you're listening to us here. Go see a professional. Okay. But nevertheless, like, they wonder, like, what else can they do? And then so there's a chunk of the population that consider bariatric surgery as an option. Definitely. And again, you know, I want to reiterate the point that we are not medical professionals, but just from our own studies and research, we do know that bariatric surgery is a viable option for individuals who have not shown a decrease in weight from, against the pharmacological approaches, maybe physical approaches, as you mentioned, just isn't working. If there's a pain component that is there, maybe there's other stress on the lower extremities. And again, diet therapy doesn't necessarily work for everyone, right? There's multiple studies that show that just diets in general, they're difficult to stick to, and even if you do stick to them, some of those behaviors or cravings can come back up, and even come back 2, 3, 4 times fold. Yeah, and then considering eligibility, like you talked about, you know, some of the things that it's taken in consideration. So, for instance, like whether or not somebody has tried other things as part of like attempts to lose weight, but it's important to think back with something that we mentioned earlier, the BMI. So if they fall under what they call the class 3, so the BMI of 40 or higher. So again, it's something that they refer to as extreme or severe obese. Sure. So just going to give a little bit of background on the effectiveness of bariatric surgery. And, you know, over the years, it's become a viable option, as we mentioned, and it's actually shown to be greatly effective short-term, right? So there's still longitudinal studies that are coming out, and the results are kind of back and forth, but short-term, it's really undeniable, right? So some studies point to almost a 35% of initial body weight loss, right? So that is a significant amount, right? I mean, that can really increase just quality of life and being able to move around, right? And as we know, that component of physical activity, being able to
do more things, increases quality of life, which therefore, as we mentioned earlier, will decrease things like depression, stress, social phobia, and some of those negative thoughts and aspects that are accompanied by obesity.
Yeah. I mean, it sounds like, it's very appealing. Like if you go to a doctor and it says, well, you're going to lose 35% of your initial body weight. I'm like, okay, count me in, like I'll do it right away. So I don't know if there's any type of like miscommunication, or difficulties understanding, or maybe like they don't process all the information, right? They just focus on like, as soon as you tell me it's 35%, like I don't hear anything else.
Right.
So there are different things to consider here. For instance, like there's a plateau, right? So you can lose it's possible that you're going to lose up to 25%. Maybe someone will lose a little bit more. Some people will lose a little bit less, but then it plateaus, right? And then people will regain an amount of weight. And I think studies show that some people regain just as much or even a little bit more weight than before the surgery. And that I think it's between 2 and 10 years.
Yeah. 2 and 10 years, there tends to be a plateau, and that plateau, and we could talk about that a little bit as well. If you are losing a considerable amount of weight and then you hit that plateau, that can also be a point where that individual is again psychologically compromised, right? And what exactly is going on? And I could speak a little bit from my personal training experience, where that when we would follow up with patients, that was a difficult period as well. What am I doing wrong? Why am I not continuing to lose weight? So a lot of that comes with being able to provide psychoeducation to the patient on our end, and of course on the surgeons and physicians end as well. But yeah, and with the majority of patients who undergo, there is a plateau. And
then there are many variables associated with that plateau, right? And one, the patient is going to start to think that they're not capable of doing anything, right? So again, it hits their mental health. And then, so you think about, okay, so if the mental health is coming after the surgery, was it before the surgery too? So pre-operation, like psychopathology. So what was the presentation of the patient before surgery? Did they meet criteria, or had a presentation of depression, anxiety, X, Y, and Z, and different medical conditions as well, because those can influence and interfere with the loss as well as the maintenance of this weight loss, right? The transition.
Definitely have to take into consideration those comorbidity factors. So just going to provide a few articles here in terms of the effectiveness of bariatric surgery. So Maggard, Gibbons, and colleagues, they performed a short-term outcome bariatric surgery study, and these individuals were diagnosed, of course, with obesity and also diabetes, and they showed that these individuals had a significant weight loss following surgery, and also better intermediate glucose outcomes, right? So that the diabetes factor was also analyzed, and it showed that bariatric surgery is a viable option for both. Moreover, there was a little bit of a more long-term outcome study, and this was conducted by Korkalos and colleagues, and they looked at a 2-year follow-up of bariatric surgery patients. And what they showed is that weight loss actually showed that patients were continuing to lose weight up to 5 years after surgery. And then medical diagnoses like diabetes and hyperlipidemia were actually improved with bariatric surgery as well. So just from the research, and of course, these are just 2 articles, but the research does show that if the patient meets criteria, if they're stable psychologically, if they have the proper psychoeducation, it can really be a life transformer, definitely.
Yeah, and as you mentioned, being in a place where there's psychological stability, right? Meaning the mental health, as a definition of mental health, this person has coping skills and has the knowledge and applying the knowledge towards themselves and their environment to benefit them, right? So that so even if there was depression before, if there was eating disorder before, they had treatment, they learned coping skills, and so they can apply those skills afterwards. Because again, there's a great chance that if you didn't have the treatment or something else happened, you're likely to experience those symptoms afterwards. Because again, it's a drastic change.
Of course.
Right? You lose what, let's say 35 pounds in, I don't know, 1 month, 2 years, whatever given time. It's like a big change. And we believe that without the being observed and being receiving the treatment by a mental health professional is really difficult. It's not impossible to do it, you know, but we do, of course, recommend people to see a mental health professional, not only these situations, but in many other life changes too. It's just like seeing yourself in the mirror, you know, it can be rewarding, of course, you know, and the changes in clothes and whatnot, but it's also, it's lifestyle change. It's major change in your life, because you can't eat, you're not supposed to eat the same things that you used to eat before your surgery, right? Not only just the content itself, but also the amount and whatever you used to drink too. So there's a lot of modifications. And they also, based on what we've read so far, that they continue to reiterate the idea of physical activity. So that again plays into like, it's a lifestyle change. It's not just the surgery and then you go back to who you, like whatever you're doing before. It's everything is going to be modified. Yeah.
And that gives so much credence as to why it is important for a mental health professional to be a part of that team. And in the majority of cases, they are, right? So a psychosocial evaluation is typically required. And you touched on many of the points as why that's necessary. You know, it's not just losing weight. It's actually becoming a new person. It's going into a new lifestyle. If food was used as a coping source, you're taking away that. You know, literally taking away, they can't eat as much as they used to, depending on the surgical operation, of course. But and you're taking that piece away. So there needs to be some structure there and help by a mental health professional to say, okay, yes, we're taking this away, but we're going to implement some of these other things, some of these more healthy coping skills, healthy coping mechanisms, right? It's extremely important. For that psychosocial eval to really cover everything and to be a structured interview and includes all the difficult questions.
Exactly. And then to understand the possible complications too, right? Because not everyone goes through it and doesn't have complications. I don't know the percentage per se, but I do hear some stories. I have heard some stories of complications following bariatric surgery, and they are very concerning. You know, when it comes to recovery too, people think they're going to be out and about, maybe, I don't know, within a couple of weeks or whatever the doctor tells them, but then it takes them longer. Because again, of the complications, you know, of how the body processes. Sometimes they have to go to surgery more than one. So again, they can be a small number, but I think it's important to consider that when you're making a decision. And you mentioned, right, the psychosocial evaluation. So it's important to, again, be comprehensive, but most importantly, it's to be done by a mental health professional. And unfortunately, we don't know, and we can't say 100% sure that every single hospital or every single clinic utilizes the resources of a mental health professional. Sometimes it is done by a medical professional, and the medical professional will provide a mental health related advice. Not that they don't have like some training, they might have some training. It's just that the person providing treatment and to know more about the mental health component will be a mental health professional. And so it's important to understand it, like who is part of that team. And then if the mental health professional, if there's credentials, you know, that suffice and meet, like it's the person's competent to provide that kind of service.
Sure. And again, all of this information is really leading up to the main point of this kind of talk and mini series about bariatric surgery. And that's our understanding of what kind of compensatory behaviors and things can occur, right? And we touched on a few things more of the psychological components, but in our next episode, we're going to really get into some of the main behaviors that really aren't talked about as much, right? More of the disordered eating behaviors and how that can impact outcomes, right? So it's so important to really cover everything in that pre-surgical evaluation and be able to speak about it openly.
Yeah, and not just do like a check, you're just going through a series of questions. Okay, check. I ask, right? I did what I'm supposed to, I ask all the questions, but is this really what you're supposed to do as a mental health professional, or
right.
More importantly, as a psychologist, right? Because there are different mental health professionals, and some may or may not be competent to do that type of job. Some will just read some questions from a questionnaire, and then some, will be more comprehensive, which is then again great, because there's more benefit to the patient when it's so, but not just completing a checklist, but also providing treatment when treatment is to be provided. So I am looking forward to learning more about, sharing the knowledge with you all, the compensatory behaviors. There's things that we're going to talk about. It's not even a DSM, and as Ronnie said, it's not often talked about. So, and to keep in mind when I work with that population, or maybe just talking with that population.
Yeah, so I hope that this first episode gave a lot of background information, and we kind of cleared up some things with obesity, talked about some of the myths, and really gave a good understanding of the effectiveness of bariatric surgery and why that is such a viable option and talked about option. But, not to forget that there is, of course, a mental health component with that, and something that we need to take into consideration. So with that background, with that ground, excuse me, with that background, we're going to end today's episode, and please join us for our next episode. And
join us for our next episode, and we'll be staying Psyconnected on Instagram, Facebook, and Twitter. Let's Psyconnect, all one word, lowercase. And if you want access to the resources that we referenced today, we're going to be posting them on our episode description as well as in our social media, but you can also request via discussion at letspsyconnect.com. And remember, let's Psyconnect.